Question number 1. Which infection control measure is most effective in preventing the spread of infections? Correct option is B. Hand washing. Question number 2. What is the first step in the management of a patient with airway obstruction? Correct option is C. Open the airway. Question number 3. Which solution is isotonic and commonly used for IV rehydration? Right option is B. 0.9% saline. Question number 4. Which is the primary organ affected in pyelonephritis? Correct option is B. Kidneys. Question number 5. Which type of wound healing occurs when a wound is closed with sutures? Right option is A. Primary intention. Question number 6. What is the most common route of transmission for hepatitis B? Right option is C. Bloodborne. Question number 7. Which part of the brain controls body temperature? Right option is C. Hypothalamus. Question number 8. Which drug is used to treat anaphylactic shock? Right option is B. Adrenaline. Question number 9. Which condition is characterized by protein in the urine during pregnancy? Right option is B. Preeclampsia. Question number 10. Which stage of wound healing involves the formation of granulation tissue? Right option is C. Proliferative phase. Question number 11. Which nursing process step involves collecting patient data? Right option is C. Assessment. Question number 12. Who is considered the founder of modern nursing? Correct option is B. Florence Nightingale. Question number 13. What is the correct angle for inserting the intramuscular injection? Right option is D. 90 degrees. Question number 14. Which type of care focuses on preventing illness and promoting health? Correct option is A. Primary care. Question number 15. Which pulse site is most commonly used in emergency situation? Correct option is C. Carotid. Question number 16. What is the normal range of oxygen saturation SpO2 in a healthy adult? Correct option is C. 95 to 100%. Question number 17. What is the recommended depth for chest compressions during adult CPR? The right option is D. 2.2 to 4 inches. Question number 18. What does the abbreviation PR mean in medication administration? Correct option is C. Per rectum. Question number 19. Which component of the nursing process involves setting measurable goals for the patient? Correct option is B. Planning. Question number 20. Which position is used to promote drainage after abdominal surgery? Correct option is B. Fowler's. Question number 21. What is the first action a nurse should take when a patient falls? Correct option is B. Assess for injuries. Question number 22. Which type of shock is caused by severe allergic reactions? Correct option is C. Anaphylactic shock. Question number 23. Which type of anemia is caused by vitamin B12 deficiency? Right option is D. Pernicious anemia. Question number 24. Which condition is characterized by severe pain in the right lower quadrant of the abdomen? Right option is B. Appendicitis. Question number 25. Which is the most reliable indicator of fluid volume status? The right option is C. Daily weight. Question number 26. Which surgical procedure involves the removal of the gallbladder? Correct option is B. Cholecystectomy. Question number 27. What is the most common symptom of a pulmonary embolism? Correct option is C. Shortness of breath. Question number 28. Which medication is a common anticoagulant used to prevent blood clots? Correct option is B. Heparin. Question number 29. What is the hallmark symptom of a urinary tract infection? Right option is B. Dysuria. Question number 30. What is the recommended position for a patient after a lumbar puncture? Correct option is B. Supine. Question number 31. What is the primary cause of respiratory distress syndrome in preterm infants? The right option is B. Lack of surfactant. Question number 32. Which vaccine is given to prevent measles, mumps, and rubella? Correct option is C. MMR. Question number 33. What is the recommended exclusive breastfeeding during for infants? The right option is C. 6 months. Question number 34. What is the most common cause of dehydration in children? Right option is B. Vomiting and diarrhea. Question number 35. Which is the most accurate site for measuring temperature in infants? Right option is C. Rectal. Question number 36. What is the most appropriate age to introduce cow's milk to an infant's diet? Correct option is C. 12 months. Question number 37. What is the first sign of respiratory distress in infants? Correct option is A. Nasal flaring. Question number 38. Which of the following is the most common cause of acute otitis media in children? Correct option is A. Bacterial infections. Question number 39. Which is the most common symptom of croup in children? Right option is B. Barking cough. Question number 40. At what age does a child typically begin to speak in two-word phrases? Correct option is C. 18 months. Question number 41. Which of the following is a sign of false labor? Right option is D. Irregular contractions. Question number 42. What is the primary method of pain relief during the first stage of labor? Correct option is C. Breathing techniques. Question number 43. During the third stage of labor, what should the nurse monitor for? Correct option is B. Placental explosion. Question number 44. During which stage of labor is the baby delivered? Right option is B. Second stage. Question number 45. What is the first line treatment for a newborn with jaundice within the first 24 hours of life? Correct option is A. Phototherapy. Question number 46. What is the normal Apgar score range for a newborn at 1 minute after birth? Correct option is C. 7 to 10. Question number 47. Which of the following is the best source of vitamin C? The right option is B. Citrus fruits. Question number 48. What is the primary function of fiber in the diet? The right option is A. Aid in digestion. Question number 49. Which of the following is a good source of omega 3 fatty acids? Correct option is B. Fish. Question number 50. What is the recommended daily intake of calcium for a pregnant woman? Correct option is B. 1000 milligram. Question number 51. Which of the following food is a rich source of iron? Right option is B. Spinach. Question number 52. Which nutrient is essential for wound healing and immune function? Correct option is C. Protein. Question number 53. What is the primary source of energy for the brain? Right option is C. Carbohydrates. Question number 54. Which food is high in folate essential for pregnancy? Right option is B. Liver. Question number 55. Which of the following is an example of a complete protein? Correct option is C. Eggs. Question number 56. Which of the following is the best source of dietary fiber? Right option is B. Whole wheat bread. Question number 57. Which vitamin is essential for the absorption of calcium and phosphorus? Right option is A. Vitamin D. Question number 58. What is the recommended daily intake of water for an adult woman? Right option is B, 2 to 3 liters. Question number 59. Which of the following is the most common source of dietary cholesterol? Correct option is C, animal products. Question number 60. Which nutrient is primarily responsible for building and repairing body tissues? Right option is C, proteins. Question number 61. Which symptom is most commonly associated with depression? Right option is A, insomnia. Question number 62. Which neurotransmitter is most associated with depression? Correct option is B, serotonin. Question number 63. Which drug is used in the treatment of bipolar disorder? Right option is A, lithium. Question number 64. Which condition is characterized by a loss of interest in activities? Right option is B, depression. Question number 65. Which of the following organ is responsible for filtering and detoxifying blood? Right option is B, liver. Question number 66. What is the smallest structural and functional unit of the body? Right option is A, cell. Question number 67. Which chamber of the heart pumps oxygenated blood to the body? Right option is D, left ventricle. Question number 68. Which part of the heart receives deoxygenated blood from the body? Correct option is B, right atrium. Question number 69. Which hormone is secreted by the adrenal medulla? Correct option is C, adrenaline. Question number 70. Which part of the nephron is primarily responsible for filtration? Correct option is B, glomerulus. Question number 71. Which type of muscle is involuntary and found in the walls of organs? Correct option is D, smooth muscle. Question number 72. Which organ produces red blood cells in the fetus? The right option is A, liver. Question number 73. Which part of the neuron receives signal from other neurons? Correct option is C, dendrites. Question number 74. Which vaccine is given to a newborn at birth? Correct option is C, BCG vaccine. Question number 75. Which part of the brain controls vital functions like heart rate and respiration? Right option is C, medulla oblongata.